Well, thank you very much, Mr. Chairman. My thoughts are with you and your team right now as you try to navigate the same challenge so many in our country are worried about. We all wish your staff member a speedy recovery. And as everyone works to take appropriate safety precautions today, I'd like to thank not only our witnesses for joining us today, but also our committee staff for working to set up a safe format for members and witnesses and the public to participate in this hearing remotely. Families across the country are counting on us for the truth about the COVID-19 pandemic, especially since it is clear they will not get it from President Trump. Truth is essential so people have the facts so they can make decisions for themselves and their families and their communities. Lives are at stake. If the president isn't telling the truth, we must, and our witnesses must, and we're counting on you today. And families need us to take this opportunity to dig into the facts about where things did go wrong so we can finally get them on track. Because the Trump administration's response to this public health emergency so far has been a disaster all on its own. Delays, missteps have put us way behind where we need to be on diagnostic tests and allowed inaccurate antibody tests to flood the market. Corruption and political interference have impeded efforts to secure desperately needed personal protective equipment and promoted dangerous, unproven treatments. And we recently learned that after experts at the Centers for Disease Control and Prevention spent weeks developing a detailed guide to help our communities understand how to safely reopen when the time comes, the Trump administration tossed it in the trash bin for being too prescriptive. But this is far from the first time this administration has silenced experts who were doing their job and putting public health first. The fact of the matter is, President Trump has been more focused on fighting against the truth than fighting this virus, and Americans have sadly paid the price. Since this committee last heard from these witnesses on March 3rd, we have seen over 900 deaths in my home state of Washington, over 80,000 deaths nationally, and the numbers continue to climb. Still, President Trump is trying to ignore the facts and ignore the experts who've been very clear we are nowhere close to where we need to be to reopen safely. My hope today is that we can cut through this and have a serious discussion about what is needed to safely open, how close we are as a country to meeting those needs, and how we actually get there. One thing that's abundantly clear, we need dramatically more testing. It is unacceptable we still don't have a national strategic plan to make sure testing is free, fast, and everywhere. That is why I fought to make sure our last COVID-19 package included an initial $25 billion testing fund and a requirement that the administration submit a plan by May 24th. And when I say a plan, I don't mean a PR plan. I mean a plan with specific timelines and numeric goals for supply and funding needs, one that actually addresses the issues we're seeing on testing capacity and distribution and disparities and building out our public health system, and makes clear to states and tribes and employers and the American people what they can expect and what the administration will do to keep Americans safe. But testing alone won't be enough to reopen our country. We still need far more personal protective equipment than has been available for our healthcare workers on the front lines. And we will need far more for other workers as we reopen. So we desperately need this administration to step up and get that equipment to states who are doing everything in their power to purchase supplies, but simply cannot get nearly enough. Because the reality is, unlike states, the federal government has the tools to actually fix the problem if only the administration would use them. And we also need that equipment to actually work and for the FDA to act promptly if it does not weeks later when people may have already been exposed. And just as importantly, we can't expect people to go back to work or to restaurants or to confidently send their kids to school if there isn't clear, detailed guidance about how to do that safely. Schools, from early childhood through college, need to know how to keep their students, their staff, and their educators safe. When should they wear masks? How do you run a school cafeteria or a school bus? And if they can't reopen classrooms, schools and families need to know we are working to ensure every student gets an education. Tools like online learning can only get us so far if we don't address the digital divide so that every student can access them. And even then, there will be learning loss that could deepen existing educational disparities among low-income students, students with disabilities, English language learners, and other vulnerable populations if we don't make sure they get equal access to resources and support. And of course, schools aren't the only workplaces we've got to be thinking about. We need to make sure that industries across the country know how to safely reopen and that people know their workplace is safe. Secretary Scalia needs to stop dragging his feet and do his job and have the Department of Labor set forward a rule that makes clear worker safety is not optional. Mr. Chairman, I hope this committee can hear about those critical issues from Secretary Scalia and Secretary DeVos, as well as other experts in the space in the days ahead. And this is especially important to protect workers and residents at our nursing homes and other congregate care facilities, where we've seen some of the most deadly outbreaks. And as the rash of outbreaks at meatpacking plants shows, this isn't just an issue for the healthcare industry, it is an issue for everyone. And just as we need a plan before we can start to reopen, we also need a plan well before we have a safe and effective vaccine to guarantee that we can quickly produce and distribute it on a global scale and make it free and available for everyone. So I'll be asking about our progress on those issues today. Today, safely reopening our country may be a ways off, and the administration's planning may be way behind. But there's still a lot that Congress needs to do. There isn't time to spare. Some, including the White House, say we've already provided enough economic relief. Well, my question to them is, what good is a bridge that only gets you to the middle of the river? We don't need to wait around to see if people need more help. We know they do. We need to work quickly on another aggressive relief package, and we need to make sure our priorities in that bill are protecting our workers, our students, and our families, and addressing this public health crisis, not bailing out corporations or protecting big business from accountability. People across the country are doing their part. They are washing their hands and wearing masks and social distancing and staying home. They need their government to do its part too. They need leadership. They need a plan. They need honesty, and they need it now before we reopen, so they can rest assured that we are doing things safely and competently with their health and well-being as a top priority. Thank you, Mr. Chairman.